Last week, you recorded every combustible cigarette or e-cigarette you smoked when you smoked it. We know this is tedious. However, this is one of the most important aspects of the Cooper-Clayton method. The exercise should have made you actually aware of the role that nicotine self-administration plays in your daily life. The recording form covers 7 days. The 24 hours in each day are divided into 30-minute segments. Looking down the column for each day, you can add the number of cigarettes you smoked each day. For most people, the total number of cigarettes smoked each day is about the same from day to day. This is true even when smokers are restricted from smoking at work or in other public spaces and places. In such cases, smokers tend to concentrate their smoking at times and in places they are allowed to smoke. For the purpose of nicotine replacement therapy, you should assume that you got 1 milligram of nicotine from each cigarette.
Now you should look across the rows in each of the 30-minute segments. This will show the degree to which your smoking is concentrated during the day. This is because there are so many public places, including workplaces, where smoking is prohibited. When there are times during the day you can't smoke, it's likely you may be getting more than 1 milligram of nicotine from each cigarette. As we noted last week, the cigarette is such an effective and efficient drug delivery device. You can get up to 3 milligrams out of each cigarette. So if you used to smoke 30 cigarettes a day and now smoke 10 cigarettes a day, the chances are you may be smoking each cigarette differently. You can get up to 3 milligrams of nicotine out of a cigarette by altering your smoking topography. You can change the yield of nicotine from each cigarette. Does this describe what has happened to your smoking patterns?
Based on your smoking patterns and assuming you are getting 1 milligram from each cigarette, let's determine how to replace the nicotine you were getting from cigarettes with nicotine from one of the 3 NRT products. There are 3 over-the-counter NRT products used by participants in the Cooper-Clayton method to stop smoking. 1, the passive Nicoderm CQ patch. 2, the oral administered 4 milligram commit lozenge. And 3, the oral administered 4 milligram Nicorette gum. You can choose to use any one of the 3 products as the sole source of nicotine. Based on the thousands of smokers with whom we've worked, our initial recommendation is for you to use only the Nicoderm CQ patch. This seems to be sufficient for almost every smoker. If the patch doesn't seem to be sufficient, we usually recommend that you supplement the patch with up to 4 4-milligram commit lozenges or 4 4-milligram pieces of Nicorette that will allow you to be more comfortable.
So the first replacement option is the Nicoderm CQ nicotine patch. The Nicoderm CQ patch is a transdermal nicotine delivery system that is placed in a non-hairy location on the upper body. It delivers nicotine first into the skin and then into the capillary bed of the upper body. One of the most common questions we've heard is, can the patch be worn on other spots on the body? There are several plausible and possible answers to this. The first is, however, that would not include anywhere on the neck or a highly vascular area. We do know that many women use HRT products below the waist. The best answer to the question is that research has not been conducted to see if it's possible to wear the nicotine patch anywhere other than the upper body. Therefore, our recommendation is that you wear the patch on a non-hairy location on the upper body.
Another question we often hear is, I only smoke when I'm awake. Do I really need to wear the patch for 24 hours? The answer is yes. The patch is designed to deliver 80% of its nicotine during the first 16 hours it is worn and only 20% during the final 8 hours during your sleep. The reason you wear the patch even when you're asleep is that smokers store up nicotine in body tissue during the day, and when they're asleep, usually during the night, that nicotine is released in order to keep blood nicotine levels up. Some participants in the Cooper-Clayton method have said that they want to use the daytime-only patch. This probably reflects the fact that a number of years ago there was a patch advertised as a daytime-only patch. It was not successful.
The Nicoderm CQ patch is designed to be worn for 24 hours. However, there's one legitimate reason to wear it only during waking hours. For those who experience some sleep disturbance while wearing the patch, it can be removed at bedtime and a new patch applied at the beginning of the next day. The beginning of the next day is an important term. Some individuals work the night shift. They are awake and working while the rest of us are asleep. Therefore, when using the patch, put it on at the beginning of your day, your waking hours.
As you begin the process of becoming a non-smoker using the Cooper-Clayton method, it is important to know what you are up against. Smoking is addictive in both physical and mental, emotional ways. You must overcome both in order to successfully become a non-smoker. And while use of the Nicoderm CQ patch will lessen your body's craving for nicotine, it is important that you also make a commitment to become a non-smoker. This is important because almost all of us are better at making and keeping promises to others than we are at keeping promises to ourselves. You're becoming a non-smoker for you, not for anyone else. This is a mental and emotional commitment. Once you've decided that you're going to become a non-smoker, it's time to get started. But first, there's some important warnings and cautions about using nicotine replacement products.
First, this product is only for those who want to stop smoking. If you're pregnant or breastfeeding, it's very important for your healthcare providers to know what you plan to do and to get their input on this decision. Nicotine crosses the placental barrier. If you're pregnant or nursing, it's important for you to know that the developing fetus is receiving nicotine you're using, whether it is from a cigarette, an e-cigarette, or a nicotine replacement product, like the patch. You should also know that nicotine has a vasoconstricting effect. It tightens the blood vessels. Smoking a combustible cigarette produces a number of dangerous gases, like carbon monoxide, and the vapor from e-cigarettes contains known toxic ingredients.
There's almost no research on the effects of using nicotine replacement products when a person is pregnant or nursing. However, the Food and Drug Administration is very clear. A person should not smoke at all if pregnant or nursing. It would also be wise to avoid using nicotine replacement products while pregnant or nursing because they contain nicotine. On a few occasions, someone has said to us that nicotine replacement products do not contain any of the gases produced by combustible cigarettes. This is correct. However, the risks to your developing child from this medicine have not been studied and are therefore not fully known. The same can be said about the vapors produced by e-cigarettes. There's not enough rigorous research on what is in the vapors. We do know that nicotine is an ingredient in e-cigarettes. Therefore, the axiom of better safe than sorry is probably the best advice.
Please understand, do not use a Nicoderm CQ patch if you continue to smoke combustible cigarettes or use e-cigarettes, chew tobacco, or use snuff or other smokeless tobacco products.
Consult with your healthcare provider before using the nicotine patch if you have A, heart disease, a recent heart attack, a regular heartbeat. Nicotine can increase your heart rate. High blood pressure not controlled with medication. Nicotine can also increase your blood pressure. An allergy to adhesive is another contraindication. Or if you have skin problems because you are more likely to get rashes. Ask a doctor or pharmacist before use of the nicotine patch if you are using a non-nicotine stop smoking drug or taking a prescription medication for depression or asthma. When using the nicotine patch or other NRT products, it is possible the dosage from other prescription medications may need to be adjusted.
When using the nicotine patch, do not remove the patch and smoke a cigarette. The reason for this is that nicotine in your skin will still be entering your bloodstream for several hours after you take off the patch. In addition, the nicotine from the patch enters the bloodstream at a steady pace. Smokers are used to getting a bolus or jolt of nicotine from their cigarettes. Therefore, by smoking a cigarette, you may be adding a large dose of nicotine on a higher blood nicotine level from the patch. This could produce an overdose of nicotine.
Keep NRT products out of the reach of children and pets. Used patches have enough nicotine to poison children and pets. If swallowed, get medical help or contact a poison control center right away. In addition, dispose of the used patch as soon as you take it off. If you're under 18 years of age, ask your primary care provider to write you a prescription for an NRT product. Nicoderm CQ, the commit lozenge, and the Nicorette gum have not been studied in samples of individuals under the age of 18.
If you smoke more than 10 cigarettes per day, you will start with the 21 milligram patch and use it for 6 weeks. After 6 weeks, you will switch to the 14 milligram patch for 2 weeks, and then drop to the 7 milligram patch for 2 more weeks. If you smoke 10 or less cigarettes per day, you will start with the 14 milligram patch and use it for 6 weeks, and then drop down to the 7 milligram patch for 2 weeks. After those 8 weeks, you should be nicotine free.
Whether you start with the 21 milligram patch or the 14 milligram patch, you need to do the following things. First, stop smoking combustible or e-cigarettes completely. At the beginning of your day, take either the 21 milligram patch or 14 milligram patch from its protective packet only when you're ready to apply it. Remove the clear coating to expose the adhesive side. The clear coating is split down the middle to help you. Take care to touch the adhesive side as little as possible with your fingers. Apply the patch to a non-hairy, non-irritated part of the upper body which is free of lotion or oil. Press it firmly with the palm of your hand for about 10 seconds. Then wash your hands. Nicotine on your hands from handling the patch could be very irritating, particularly if you touch your skin near your eyes. Continue to wear the patch for 24 hours. Remember, this is the first day of using the patch and you're not used to getting your nicotine in a steady pattern. It may take a couple of days for you to get used to this pattern. Don't panic. Things will get better. If your sleep is disrupted by wearing the patch, be a little patient. If the sleep disruptions continue, you may want to consider removing the patch at bedtime. Apply a new patch at the beginning of each day at approximately the same time, and always rotate the place you apply the patch from one day to the next in order to minimize skin irritation.
The Nicoderm CQ patch is not designed to give you as much nicotine as a cigarette did. Let it work. We have an incredible amount of experience with participants in the Cooper-Clayton method using the patch. These are some of the lessons we have learned. First, each day you wear the Nicoderm CQ patch with 0 nicotine from cigarettes, you can expect to get a little more comfortable. Most people report they are very comfortable fairly quickly. A few say it takes a bit longer. Please be patient. Second, let's deal with this first day and the days during the first week as a learning experience. Your brain must become comfortable with this new way you're giving it nicotine. Remember, you're used to getting a large hit of nicotine from combustible cigarettes. The patch will be delivering its nicotine in a steady state at a steady pace. You have to become used to this difference in nicotine self-administration. Third, a study of nicotine patch users conducted at Duke University showed that those who had even one puff on a cigarette the first day were 10 times more likely to be smokers 1 year later. Fourth and most important, the Nicoderm CQ patch is not magic. It is medicine. Let it work. For the next week, stay busy. Think of the thousands of dollars you're going to save each year because you've decided to stop smoking. Think how much better you will smell and feel. This is step 1 in your journey toward better health. You will visit us each week at the same time for the next 12 weeks. The material covered each week is strategically designed to tell you what to expect the following week.
A large majority of the folks who have become non-smokers using the Cooper-Clayton method have chosen to use the Nicoderm CQ patch. However, there are 2 other nicotine replacement options you should consider. Each can be used independently as the sole source of replacement nicotine. The commit lozenge and the Nicorette gum are both oral medications delivering nicotine through the cell membranes in the mouth. Both are used during waking hours. Each provides nicotine into the bloodstream fairly rapidly, usually within 10 to 15 minutes if used the way we describe. Up to 24 milligram commit lozenges or 24 pieces of 4 milligram Nicorette gum can be used each day. They each provide nicotine rapidly, usually within 10 to 15 minutes.
Let's first describe how someone who is smoking 1.5 packs or 30 cigarettes a day would use either the commit lozenge or the 4 milligram Nicorette throughout the day. If you're smoking 30 cigarettes a day, let's assume you can get comfortable with 80% of the 30 milligrams of nicotine you're getting from cigarettes. This suggests you will need 24 milligrams of nicotine from the oral NRT. That would mean using 12 pieces of either of these oral NRT products because each delivers about 2 milligrams of nicotine if used effectively. There are 960 minutes and 16 waking hours. If you need to use 12 pieces of commit or Nicorette, you would need to use another new piece every 80 minutes throughout the day.
A pattern for someone who smokes a pack of 20 cigarettes a day is shown. If you smoke a pack or 20 cigarettes a day, 80% of 20 is 16 milligrams. You would need 8 pieces of commit or Nicorette to replace the nicotine from cigarettes with nicotine from the oral replacement product. Someone who is awake and up 16 hours will use another new piece of the oral Nicorette product every 120 minutes or every 2 hours.
We now want to describe specifically how to use the 4 milligram commit lozenge. First, rinse your mouth with water before using each commit or Nicorette. If you're using the lozenge, remove it from the package, place the lozenge on your tongue, roll it over 2 or 3 times to moisten it, and then park it between the cheek and gum. Repeat this every 3 to 4 minutes until the lozenge is fully dissolved. Minimize swallowing. Do not chew or swallow the lozenge. It's very important that you drink no beverages while you have the lozenge in your mouth. Only 2% of nicotine that is swallowed becomes blood nicotine, while 86% of nicotine absorbed through the cheek becomes blood nicotine. Although it is very unlikely you will need more than the 8 pieces if you smoke 20 cigarettes or 12 pieces if you smoke 30 a day, it's possible for you to use up to 20 pieces a day if needed.
Now we want to describe specifically how to use the 4 milligram Nicorette gum. First, rinse your mouth with water before using each piece of Nicorette gum. Bite into the Nicorette 4 or 5 times so that a new surface is exposed. Do not chew the Nicorette vigorously. All you need to do to release the nicotine is to wet the outside of the product. Then park the piece of Nicorette between the cheek and gum until the tingling feeling is gone. Treat it like a patch inside the mouth. The biting parking cycle is repeated until most of the nicotine is gone. The Nicorette is used during working hours. Although it is very unlikely you use more than 8 pieces if you are a pack-a-day smoker or 12 pieces if you smoke a pack and a half, it is possible to use up to 24 pieces of Nicorette per day if needed. The commit lozenge and the Nicorette provide nicotine within 10 to 15 minutes if used properly. If you vigorously attack the commit lozenge or the Nicorette, you will release too much nicotine too quickly. Then you will swallow the saliva containing the nicotine. It will go into the stomach, which is essentially an acid holding tank. This is not a good thing. In order to become a non-smoker, you need for the nicotine to efficiently and effectively get into the bloodstream. It bears repeating that only 2% of the nicotine that gets into the stomach becomes blood nicotine, while 86% of the nicotine absorbed through the cheek becomes blood nicotine. You need to keep the blood nicotine level as high as you can in order to become a successful non-smoker.
Absorption of nicotine from the commit lozenge or the Nicorette gum occurs through the oral mucosa. Nicotine will not cross the cell membrane in the mouth at a pH under 7.4. You remember pH from your high school chemistry class. Anything under 7.0 is acidic. Anything above 7.0 is alkaline. Therefore, in order to get the maximum benefit from the lozenge or the gum, it's important to keep the oral mucosa alkaline. The best way to do this is to begin by rinsing your mouth with water. Water has a pH of 7.0. In addition, do not use any beverage while you're using either the lozenge or the gum. Remember, we're not asking you to completely give up use of these beverages, just asking you to avoid using them simultaneously with these NRT products.
One other suggestion is critical. Do not wait until you're experiencing symptoms of withdrawal before using another piece of lozenge or gum. You want to have some nicotine on board before the symptoms appear. Try to establish a consistent pattern of using these 2 oral nicotine replacement products. That is, use another piece in a consistent pattern throughout the day.
For those of you who will use the commit lozenge or the Nicorette gum, the first questions we usually get is, Once I get on this, how do I get off of it? The answer is slowly and steadily, not too fast or too slow. The first 2 weeks on the lozenge or gum, be sure to use it on a steady, timed basis, one piece every 80 to 120 minutes apart, depending on how many cigarettes you were using. Assuming a cigarette delivers 1 milligram of nicotine per cigarette, you should assume you can get at most 2 milligrams of nicotine from each piece of 4 milligram commit lozenge or Nicorette gum. That is, if you use it with maximum efficiency.
After 2 weeks on your starting dose, drop the first piece of lozenge or gum of the day every day that next week, but use all the other pieces on the same schedule as before. The next question is usually, why the first piece? Why not the last piece? Well, there are two simple answers. First, just like the first cigarette of the day is the most important, the first piece of the nicotine replacement will probably be the one you will need the most. Second, when you're under stress, as in waiting all day knowing you will have to drop the last piece of the day, your urine will be considerably more acidic. The stress makes it more acidic. If your urine is acidic, that increases the speed with which your body gets rid of the nicotine you put in it. That is not a good thing.
You will continue the pattern of eliminating pieces of the oral nicotine replacement products. Each additional week you will eliminate one piece every day from the front end to the back end of your day. Ultimately, the goal is to get you to the point of using 0 pieces of lozenge or gum.
You'll be pleased to find out that your brain will accept the reduced amount of nicotine in a steady administration fashion without experiencing withdrawal and being miserable. Your brain will adjust to this new schedule and the reduced amount of nicotine. At the end of week 12, you should be nicotine-free. What a great feeling.
Remember, either the 4 milligram commit lozenge or the 4 milligram Nicorette gum provide a temporary source of nicotine to your brain to relieve craving without the tar and carbon monoxide you got from cigarettes. The lozenge and the nicotine gum deliver the same nicotine as provided by the cigarette, just in a safer form. You do need to know that some people find the nicotine gum can cause, occasionally, nausea, hiccups, upset stomach, or dizziness. This only occurs when the nicotine gum is chewed too rapidly. It is important to minimize swallowing the nicotine. This allows the nicotine to be absorbed through the lining of your mouth.
Some helpful suggestions. Neither the 4 milligram commit lozenge or the 4 milligram Nicorette are designed to give you as much nicotine as a cigarette did. Each week you use the 4 milligram commit lozenge or the 4 milligram Nicorette with 0 nicotine from cigarettes, you can expect to get a little more comfortable. This is because the liver enzymes reduce in number about 8 days after you lower the dose. Please be patient. Let's deal with this first day. First week is a learning experience. Your brain must become comfortable with this new way of giving it nicotine. The lozenge and the nicotine gum are not magic, they are medicine. Let them work.
Combined use of nicotine replacement products. As mentioned earlier, in most cases, we recommend use of the Nicoderm CQ patch as your sole source of NRT. If you encounter some unexpected stressful situations, we recommend you add up to 4 4-milligram lozenges or 4 4-milligram pieces of Nicorette to get you through that period. This seems to work well for everyone we've worked with.
In later sessions, we'll help you minimize weight gain, increase your physical activity, and deal with life's pressures as you slowly eliminate nicotine from your life. Let's take this one step at a time. It's now time to continue your journey towards becoming nicotine-free. You can do this.
Everyone who uses the Cooper-Clayton method is not successful. Stopping smoking is very difficult. Among smokers who decide to become a non-smoker without using any NRT product, about 5 will be non-smokers 1 year from today. Among smokers who go to the pharmacy, buy an NRT product, and begin using it, about 8% will be non-smokers 1 year from now. We have published papers describing smokers who have used the Cooper-Clayton method. Anywhere from 40 to 45% of those are non-smokers at 1 year. We measure their claim to have become a non-smoker by using an exhaled air carbon monoxide device. Importantly, 80% of those who were non-smokers at 1 year were also non-smokers 3 years later.
There are three things that people who succeed using the Cooper-Clayton method bring with them at the beginning of the process. First, they have made the decision that being a non-smoker is more attractive than being a smoker. Second, they're willing to accept some discomfort in making the transition from smoker to non-smoker. And third, they have confidence in the program they're going through, and they have confidence in the method they're using. Thousands of people have used the Cooper-Clayton method to become non-smokers. We know the program works, and it will work for you. Don't try to change it. It is not broke. Don't try to fix it. Good luck.